in the somatic nervous system, they act in a skeletal muscle in the which receptor that acts in a skeletal muscle? Muscarinic. What are the two different types of receptors for cholinergic system? Muscarinic and nicotinic. Muscarinic, subdivision of muscarinics are M3. Subdivision of nicotinic are NM and NN. Skeletal muscle, which receptor present? First, muscarinic or nicotinic? Nicotinic. Which type of nicotinic? Muscle for M. So NM. NM present in the neuromuscular junction. There the neurotransmitter is acetylcholine. Very good. Similarly, in parasympathetic, the main neurotransmitters are acetylcholine. But even in the sympathetic, the main neurotransmitter is sympathetic nervous system, the neurotransmitter, primary neurotransmitter for sympathetic system, noradrenaline. Very good. So for parasympathetic it is acetylcholine, for sympathetic it is not adrenaline but noradrenaline is the primary neurotransmitter. Here the sympathetic division also acetylcholine acts as a neurotransmitter in some spaces like in ganglia and in the adrenal medulla. In the two portion in sympathetic system also the neurotransmitter is not the noradrenaline but acetylcholine. কোথায় কোথায়? এটা ganglion and next one is adrenal medulla. Here the neurotransmitter is not noradrenaline but acetylcholine, though it is a which system it is? The system is sympathetic system. Adrenergic system, though the neurotransmitter here is in two spaces, adrenal medulla and ganglion, neurotransmitter is acetylcholine. Next one, receptors, NM. Here this is NN. NN means nicotinic receptor, NN type, and there is a muscarinic receptors in the end organ of the parasympathetic organs. This M is, what are different M? M1, M2, M3. Very good. So where it is M1 present in stomach, M2, M3 smooth muscles and glands. Smooth muscle and glands. Smooth muscle এর মধ্যে কোথায় কোথায় smooth muscle হবে? কোথায় কোথায় smooth muscle আছে? Where are the location of the smooth muscles? Eyes, then tracheobronchial tree, GI, GU. GI means gastrointestinal, GU means genitourinary. Here receptor is M3 and gland, different gland, sweat gland, tracheobronchial receptor is M3, M2 present in, M1 present in stomach. Very good. Now you tell me beta 1 present in heart. So beta 1 present in heart, M2 present in heart. Clear? Beta 3 present in, beta 2 lungs. That means tracheobronchial tree, smooth muscles. Beta 2 present in vessels, vasodilator. Alpha 1 present in blood vessels. They are vasoconstrictor. Clear? So M1, M2, M3, NM, NN. Kothai distribution? Clear? Now the receptor that blocks by which type of drugs? Neuromuscular blockers block the NM type of receptor, acts as a skeletal muscle relaxant. Similarly, ganglionic blockers block the ganglion as well as adrenal medulla. This is called ganglion blocker. And muscarinic blockers primarily block the M1, M2, M3 that is present in the peripheral organs of the cholinergic system. This is called muscarinic. So anticholinergic, if you think about anticholinergic, receptors are NM, NN and muscarinic. Then all these ganglionic blocker, NM blockers, that means skeletal muscle relaxant, as well as antimuscarinics are all under the anticholinergic drugs. But in our practice, we primarily, if we say anticholinergic, we denote it as a antimuscarinic drugs. Clear? We mention, but all these muscle relaxant, ganglion blocker or muscarinic blockers all are anticholinergic drugs. Clear? এগুলো বোধহয় পড়ানো হয়ে গেছে। ফার্মাকোকাইনেটিক, ফার্মাকোডাইনামিক, অ্যান্টিকোলিনার্জিক এর পড়ানো হয়ে গেছে। ভেরি গুড। অ্যান্টিমাস্কারিনিক এর source, what is the source? What are the different types of source of anticholinergic drug? কি drug, primary drug টার নাম কি? Atropine. It is synthetic or organic? কোথা থেকে পায়? So according to source, we can divide it natural, semi-synthetic or synthetic. Atropa belladonna is the source of atropine. Then hyoscine is another natural source. Then semi-synthetic, homatropine. Where it is used? Homatropine used in, homatropine পড়ানো হয়েছে, নাম শুনেছো? It is a semi-synthetic drug used in the eye as a topical agent. And synthetic, ipratropium, tiotropium, tropicamide. Now you tell me where this ipratropium, you heard this name ipratropium, where it is used? It is a bronchodilator. So it is used in bronchial asthma as well as COPD, chronic obstructive pulmonary disease. So this is ipratropium, tiotropium bromide used in bronchial asthma and COPD, whereas tropicamide used as a topical agent in eye. So it is the synthetic one. So if you classify, it is natural, semi-synthetic and synthetic. Then if you, according to the structure, it is quaternary and tertiary. Ipratropium is a quaternary. According to the selectivity, it is non-selective and selective. Selective one is M1 specific, where it is used, M1 specific pyrangyepine. M1 কোথায় আছে? M1 where it is present? Stomach gland. তাহলে it is, if it is blocked by someone, what will happen? In which clinical situation we can use that? Where there is a hypersecretion. Stomach hypersecretion কি হয়? Peptic ulcer. But nowadays it is rarely used. Nowadays drugs used in peptic ulcer, what is the common drugs used in peptic ulcer? Pyrangyepine. Pyrangyepine rarely used nowadays. কি খাও? গ্যাস হলে কি খাও? Omeprazole. That is proton pump inhibitor or ranitidine. That is called as a H2 blocker. These are the first line drug, but there is a drug that is acts as an anticholinergic, that is M1 specific blocker, pyrangyepine. It is used in, it can be used in peptic ulcer, but not a ideal drug or first line drug for peptic ulcer. Mechanism of action কি হবে? Mechanism of action of atropine, কিভাবে কাজ করে atropine? এগুলো তো পড়ানো হয়ে গেছে। How it acts? How drug acts primarily? What are the main 4 targets of a drug? Drug কিভাবে কাজ করে? General pharmacology, pharmacodynamic. জানো না? একটা টার্গেট and a non-target mediated. Target mediators means there is a specific protein molecule, or if there is not a specific molecule, that means due to their physical or chemical nature. Example is antacid. They neutralize the acid. There is no specific protein molecule. Clear? So, where is the specific protein molecule? Most of the drug acts by enhancing or blocking a specific molecule. What are these molecules? Huh? Now, this is called on general. One is receptor, another one is receptor, enzyme, ion channel and transporter. There are 4 main targets where the drugs bind and alter their action. Here in case of atropine, they block the receptor. Which receptor? Muscarinic receptor. All muscarinic receptors are blocked. And how it is blocked? It is competitively or non-competitive? Competitively. What is the difference between competitive and non-competitive? Structural difference, number 1. Number 2, by increasing concentration of the agonist, we can overcome the blockage. Binding in a same receptor, for competitive same receptor, different receptor, same receptor, and for non-competitive, different receptor. So how can it modulate that receptor? So same receptor for both competitive and non-competitive. For competitive, the same site of the agonist. The receptor is same for competitive as well as non-competitive. The site is different. For competitive is the same site as the agonist, and for the non-competitive same receptor but different site. You have to remember this for the MCQ. What is the difference? The receptor is the same but site is different for the which type of different site? Non-competitive, because they are structurally not similar. Clear? For competitive same receptor same site, তাহলে দুটো পোরশন আছে, একটা রিসেপ্টর একটা সাইট। Clear? For non-competitive same receptor different site. Clear? So atropine is a competitive receptor, so it is structurally similar to the কার সাথে similar হবে? agonist কে এখানে acetylcholine. So it is structurally similar to the acetylcholine. They bind with the same receptor, that means M1, M2, M3, and the site is same or different? It is same site as the acetylcholine. Clear? So it is a competitive inhibition of M1, M2, M3, and competition কার কার মধ্যে হচ্ছে? একটা হচ্ছে acetylcholine আর একটা হচ্ছে either atropine, hyoscine, ipratropium, tiotropium, homatropine. Clear? Salivary gland, bronchial and sweat gland is the most sensitive, followed by least one is gastric gland. Gastric gland is the least one. সেজন্য gastric gland এর specific কি আছে? Specific M1 receptor blocker is এক্ষুনি পড়ানো হলো, যেটা ইউজ হয় না, গ্যাস্ট্রিক পাইরেনজেপিন। সিএনএস এগুলো পড়ানো হয়ে গেছে তো? সিএনএস টিএনএস কি কি কাজ করে এগুলো, তাহলে আমরা একদম ইয়েতে যাচ্ছি। Pharmacokinetic for atropine and hyoscine, it is rapidly absorbed from the GIT when given orally. But atropine is also used in, what are the different routes of administration of atropine? Atropine কোন কোন রুটে দেওয়া যায় বলো? সাবকিউটেনিয়াস, আইভি কোথায় দেওয়া হয়? Organophosphate poisoning. Very good. Anything else? IV atropine used in organophosphorus poisoning, and if there is a sinus bradycardia, there we are giving atropine as a intravenous. Orally দেওয়া যায় কখনো? হয়, দেওয়া হয় কি? Nowadays rarely used atropine orally. Okay, and third one is আর কোন রুটে দেওয়া হয় atropine? What are the common routes where বল eye drop. So there is a commonly we are using atropine as a eye drop or eye ointment. Previously we are preparing this eye ointment in the pharmacy. Nowadays I think only ORS is for your session. So as a topical eye ointment and eye drop, and next one is commonly used is intravenously in case of organophosphorus poisoning or sinus bradycardia. But if previously it is given as the oral drug, there it is rapidly absorbed from the GIT. When applied in the eye, it can penetrate cornea smoothly. It can cross the blood-brain barrier. So what happened? If CNS effect, what are the CNS effect? There is a psychosis-like state where you can see it, where you can see the psychosis effect or CNS effect of atropine. When a patient of organophosphorus poisoning, you are administering this intravenous IV atropines. And what is the dose of that? How long we can give this atropine? কতক্ষণ দিই? কি দেখে আমরা বন্ধ করি? Atropinization. Now you tell me what is the atropinization? হ্যাঁ বলো মা। কতক্ষণ দেবে? 5 to 10 minutes. Atropinization কি করে বুঝবে? হ্যাঁ, কোন সিক্রেশন? সেটাই, that is the most important secretion. হ্যাঁ salivary secretion. More importantly, tracheobronchial secretion, because patient can aspirate due to the tracheobronchial excessive secretion which is produced by organophosphorus. In that case, sometimes you have to give it for 12 hours, 24 hours. In that situation, patient can go into the psychosis. That is one example of where we can see that CNS effect of this atropine. And why it is happened? Because it smoothly crosses the blood-brain barrier. 50% of the atropine metabolized in the liver and excreted, and 50% is excreted unchanged through the urine. Name a drug which is not metabolized in liver directly. So 100% is excreted directly through urine. MCQ. Name a drug which is not metabolized in liver directly, unchanged, excreted through urine. General pharmacology question. Lithium, where it is used? Lithium used in bipolar disorder. Very good. So lithium is given in bipolar disorder. It is not metabolized in liver, directly excreted through the urine. T-half of the atropine is 3 to 4 hours. Hyoscine is more completely metabolized as a better blood-brain barrier penetration. Now clinical use. We start from the CNS and go through it. So first CNS, where it is used? CNS in two situations. One is Parkinsonism, one is motion sickness. More commonly used in motion sickness. Motion sickness, the more commonly used, and which drug is used more commonly in motion sickness? Hyoscine. Now which route it is given? Hyoscine. কারোর আছে মোশন সিকনেস আছে? मोशन सिकनेस है की रूट है हाँ ट्रांसडार्मल पैच एंड ओरल रूट ट्रांसडार्मल पैच ओरल रूट जे कोनो ব্যাপারে before traveling 15 to 30 minutes before you have to apply it. So the number one use or clinical use effect in CNS is motion sickness, drug is hyoscine, route of administration is transdermal, nowadays more commonly transdermal, and there is some oral tablet is also available. And second one is as a drug of Parkinson's disease. Now you tell me what is Parkinson's disease? Parkinson's disease is a neurodegenerative disorder of basal ganglia. And what it happened? There is a disbalance between acetylcholine and dopamine. কোনটা কমে যায় কোনটা বাড়ে ডোপামিন কমে যায় অ্যাসিটাইলকোলিন বাড়ে তাহলে drug which increases dopamine concentration or that decreases acetylcholine effect in basal ganglia is effective in Parkinson's disease. So drug of choice of Parkinson's disease is levodopa along with carbidopa. Why levodopa? It converts into dopamine inside the CNS after crossing the blood-brain barrier. And why carbidopa is given? Carbidopa prevent peripheral decarboxylation, metabolism of this levodopa peripherally, it prevents it. So what happened? Levodopa go inside the brain and then it converts into the dopamine. This is the drug of choice. Now there is a entity called drug-induced Parkinsonism. Drug-induced Parkinsonism. What is that? There are some antipsychotic drugs like haloperidol. They acts by blocking D2 receptor, dopamine 2 receptor. But their side effect acts as a Parkinson's disease when they block in this D2 receptor which is present in the basal ganglia. Clear? That is called drug-induced Parkinsonism. Now you tell me, if we give levodopa along with carbidopa, is it effective in drug-induced Parkinsonism? Effective হবে না হবে না? Levodopa কারণটা কি? Why it is not effective? Because receptors are already blocked by the haloperidol or antipsychotic drug. So though you increase the concentration, it will not affect. Clear? So what will happen? If we give some anticholinergic benzoxazole type of drug that can cross the blood-brain barrier, they can decrease the cholinergic activity by blocking the cholinergic receptor, muscarinic receptor present in the brain. Clear? So drug of choice in drug-induced Parkinsonism is anticholinergic or centrally acting anticholinergic benzoxazole. Clear? Now there is also role of anticholinergic as a not as a first line drug but second third line drug in case of idiopathic type of Parkinsonism where it is not controlled by levodopa only. Clear? So clinical use of anticholinergic drug in CNS, most important is none. Most important is most commonly used in motion sickness. Drug is hyoscine. Root is commonly nowadays transdermal. There is a oral drug also. And second one is Parkinsonism. Which type of Parkinsonism? It is a first line drug for drug-induced Parkinsonism. Name of this drug is benzoxazole. Centrally acting anticholinergic. Is a first line drug of drug-induced Parkinsonism. It has also role in idiopathic Parkinsonism, but it is not a first line. First line drug for idiopathic Parkinsonism is levodopa, carbidopa. Clear? Motion sickness and Parkinsonism. Then second one is ocular. What is the effect of this anticholinergic in the eye? They dilate the pupil and it Mydriasis, and it helps to see the retina and vitreous. So ocular examination, it's helpful. Ophthalmoscopic examination. Next one is GIT, gastrointestinal tract. If there is a stone in which passing from the kidney to the through the ureter to the bladder, there is a spasmodic pain that can be relieved by anticholinergic drug. Similarly, in irritable bowel syndrome, colonic diverticulum, if there is a undiagnosed type of abdominal pain also, we can use anticholinergic as an antispasmodic drug. Traveler's diarrhea, in traveler's diarrhea, if it is after control of this infection, we can use atropine along with some opioid type of drugs. In biliary colic, gallbladder stone pain, we can use anticholinergic drug. Clear? So first one is CNS, then eye, then abdominal pain, either undiagnosed or if it is diagnosed as a ureteric colic or biliary colic, or if there is a colonic diverticulum, traveler's diarrhea, we can use anticholinergic drug as an antispasmodic drug in pain abdomen also. Next is urinary urgencies, because it is relaxes the smooth muscles. Oxybutynin and derifenacin. Derifenacin is they act in a receptor M3. M3 receptor present in কোথায় present করে? আর smooth muscles of কি হবে smooth muscle কোথায় কোথায়? eye, respiratory, GI, GU. You have to remember this. Respiratory disorder. Respiratory disorder means where it is used? Bronchial asthma, and more importantly, before bronchial asthma, COPD. In bronchial asthma, more important is, in bronchial asthma, drug of choice is, if we give first drug is salbutamol. That means beta 2 antagonist. Agonist. Agonist na antagonist? Agonist. And M3 blocker. You have to remember this. Beta 2 agonist, salbutamol, tarbutalin, and M3 blocker or anticholinergic. Like drug এর নাম কি? Atropine, ipratropium bromide, tiotropium bromide. And here ipratropium bromide, tiotropium bromide more effective in COPD than bronchial asthma. Clear? And along with that, they also reduce the mucus secretion. Similarly, in pre-operative pre-anesthetic medication, hyoscine is used as a pre-anesthetic medication. Why? They also reduce secretion. Why it is important? If it is not reduced, not only the tracheobronchial secretion as well as some stomach secretion, the patient can, if in case of general anesthetic, there is a gastroesophageal reflex, and that can lead to aspiration. To prevent that, they relaxes that, reduce the secretion, not only tracheobronchiality but also the stomach secretion. That prevents the aspiration. So in respiratory system, two important things. One is COPD and bronchial asthma as a pre-anesthetic medication. Cardiovascular effect. If SA node or a generation of impulse from the SA node is reduced, or there is a delay through the AV node, Atropine is helpful by blocking which receptor? হার্টে কি রিসেপ্টর থাকে? M2, by blocking M2 receptor. Clear? Sinus bradycardia, commonly we can give atropine. Cholinergic poisoning like OP poisoning through the insecticides, atropine is helpful, already discussed. Other than atropine, which drug can be given in case of OP poisoning? Atropine দেওয়া হয়, আর কি দেওয়া হয়? পড়ানো হয়েছে OP poisoning? পড়ানো হয়েছে? পড়ানোই হয়নি। মানে এইটা প্রথম মাথায় রাখতে হবে, কি পড়ানো হয়েছে কি পড়ানো হয়নি, কোন ড্রাগটা কোন সিস্টেমের, এইগুলো কি ড্রাগ দেওয়া হয় তাহলে? হ্যাঁ, প্যারালিডক্সিন, ভেরি গুড। কতক্ষণের মধ্যে দিতে হবে? হ্যাঁ, উইদিন 2 hours before the aging of this drug enzyme. So you can give it up to 24 hours also, but it is not effective after 24 hours. Okay, palidoxim or PAM. Mushroom poisoning, atropine is helpful. In hyperhidrosis, atropine substitutes are helpful. So তাহলে clinical use of atropine and atropine substitute came as a part of long question or as a long question. কি কি হবে না দেখে বলো। প্রথমে CNS, CNS এ কি কি? Parkinsonism, drug induced Parkinsonism, second line of idiopathic. Second point is motion sickness, hyoscine and transdermal patch. এটা হয়ে গেল CNS। তারপরে CNS এর পরে eye, dilatation of the pupil, helpful in retinal examination, ocular examination. তারপরে GI pain, কি কি? If there is a biliary colic or renal colic or undiagnosed pain, colonic diverticulum pain, irritable bowel syndrome, atropine can be used. In traveler's diarrhea along with morphine substitute. Then smooth muscle, lung, first lung, lunge কি হবে? COPD, bronchial asthma, pre-anesthetic as a pre-anesthetic medication. তারপরে কি আছে? হ্যাঁ, cardiovascular, cardiovascular কি হবে? Sinus bradycardia, if there is a SNO impulse generation is abnormal or AV delay, that can be counteract. And lastly, if there is a hyperhidrosis, একটা বাদ চলে গেছে কি? হ্যাঁ হ্যাঁ, poisoning, OP poisoning, mushroom poisoning, আর একটা urinary urgency, oxybutynin can be used. এগুলো কিন্তু খুব কমনলি আছে, every 3 years 4 years এ কিন্তু as a part of long question as a clinical use of atropine substitutes. তাহলে কি কি করতে হবে? কোন ক্লিনিক্যাল সিচুয়েশনে সেটা লিখতে হবে, কোন রিসেপ্টরে কাজ করে, আর ড্রাগের নাম, ড্রাগের নামটা লিখতে হবে। কোন, কারণ অ্যাট্রোপিন সাবস্টিটিউট অনেক কটা আছে, ইপ্রাটোপিয়াম, টায়াট্রোপিয়াম কোথায় কাজ করে, আইতে কোনটা কাজ করে, হোমাট্রোপিন, ট্রপিকামাইড সেটা লিখতে হবে, অক্সিবিউটানিন কোথায় কাজ করে সেটা লিখতে হবে। ঠিক আছে, এভাবে তাহলে ক্লিনিক্যাল সিচুয়েশন, কোন রিসেপ্টরে কাজ করে, আর কোন ড্রাগ, ক্লিনিক্যাল ইউজ অফ atropine substitute. Adverse effect, Mydriasis that can lead to blurring of the vision, confusion, agitation and delirium. এটা কখন দেখা যায় বললাম? সাইকোসিস কখন হয়? অ্যাট্রোপিনাইজেশন হলে। কোথায় আমরা ক্লিনিক্যাল সিচুয়েশনে দেখতে পারি? হসপিটালে ওপি পয়জনিং পেশেন্টে সেকেন্ড ডেতে এটা আমরা দেখতে পারি। দেন ড্রাই মাউথ, হট ফ্লাশিং স্কিন, কনস্টিপেশন, urinary retention, urinary retention and constipation. এটা কেন হয়? সিক্রেশন গুলো সব কমিয়ে দেয়, তার সাথে ইউরিনারি স্ফিংক্টারের স্প্যাজম করে দেয়। ঠিক আছে, দুটো জিনিস আছে, একটা হচ্ছে ট্রাইগনের রিল্যাক্সেশন আর ইউরিনারি স্ফিংক্টার constriction that can lead to urinary retention. Now that is, so for this situation it is contraindicated in some clinical situation. Why? Urinary retention কাদের হয়? In which age group urinary retention is common? Old age patient who have suffering from BHP, benign hypertrophy of prostate. Clear? In this situation, if we give some drug which has a anticholinergic effect, they can precipitate or exaggerate the effect like urinary retention. That can lead to adverse effect is tachycardia also, increased body temperature. Red as a beet, then dry as a bone, blind as a bat. Blind কেন হয়? Blind, why? There is a pupillary dilatation হয়, তাহলে ফোকাস করা সম্ভব হয় না pupillary dilatation এর জন্য. That can lead to blurring of vision. Full as a flux, urinary retention হবে. Mad as a hen কেন এটা? Psychosis, CNS effect. And hot as a hell. Sir, contraindication কি? Glaucoma. Glaucoma কি হবে? Glaucoma, if there is a mydriasis, that can precipitate acute congestive glaucoma. So if there is a patient suffering from glaucoma, we try to avoid drugs which have a anticholinergic side effect. Elderly people with benign hypertrophy of prostate. Tachycardia secondary to thyrotoxicosis or cardiac insufficiency. Cardiac insufficiency means heart failure, congestive heart failure. Paralytic ileus, non-selective M blocker, that is ulcer. In ulcer can precipitate if it is non-selective one. Selective one hole pyrangiepine, that can be used in ulcer, but non-selective one can precipitate ulcer also. ঠিক আছে? তাহলে মেন হচ্ছে সোর্স অফ দা, what is classification of the anticholinergic, এটা মাথায় রাখতে হবে. With the source, chemical, তারপর next one is use, depending upon the system. যদি ইউজটাই মনে রাখো সবকটা, তাহলে দেখবে তাহলে ফার্মাকোলজিক্যাল অ্যাকশনটাও মনে রাখা যাবে. আর মেকানিজম অফ অ্যাকশন কি? অ্যাট্রোপিনে competitive antagonist of which receptor? Muscarinic receptor. The antagonist of nicotinic type of NM type of receptor used in NM হলে neuromuscular blocker. ঠিক আছে? ডি টিউবোকিউরারাইন, সাকসিনাইল কোলিন, নামগুলো শুনেছো? এইগুলো হচ্ছে ব্লক দ্য এম টাইপ অফ রিসেপ্টরস. তাতে ডি টিউবোকিউরারিন হচ্ছে কম্পিটিটিভ, সাকসিনাইল কোলিন ইজ নন কম্পিটিটিভ. আর গ্যাংলিয়নিক ব্লকার্স ক্যান বি ব্লক গ্যাংলিয়ন অ্যাসিটাইলকোলিন অ্যাকশন ইন সিম্প্যাথেটিক অ্যাজ ওয়েল অ্যাজ প্যারাসিম্প্যাথেটিক গ্যাংলিয়ন. তাহলে acetylcholine is a neurotransmitter of cholinergic system in a ganglion and adrenal gland in sympathetic system and in neuromuscular junction. তিন জায়গাতেই neurotransmitter is acetylcholine. In case of sympathetic, neurotransmitter is noradrenaline.